About 1 in 4 adults is living with fatty liver, and many do not know it because the liver often stays quiet until the problem has already moved forward. You may not feel sharp pain. You may not look sick. You may just notice that the afternoon fatigue is stronger than it used to be. Your belly has grown around the middle. Your blood work keeps showing high triglycerides. Or there is a dull pressure under the right ribs that comes and goes. That is what makes fatty liver so easy to miss after 50. It can hide behind things people blame on age, stress, weight, or a bad night of sleep. But fatty liver, now often called MALLD and formerly called NAFLD, means too much fat has built up inside the liver. For many people, it is driven by insulin resistance, high blood sugar, belly fat, high triglycerides, and other metabolic problems. And when it is ignored long enough, fat in the liver can turn into inflammation, scarring, cirrhosis, and serious loss of liver function. The first sign people often ignore is discomfort under the right rib cage, not always pain. Sometimes it feels like pressure, fullness, or a dull ache in the upper right belly. That area is where your liver sits. This does not automatically mean fatty liver, but it is one of the few symptoms major medical sources consistently connect with fatty liver disease. If it keeps returning, especially with weight gain, diabetes, or abnormal blood work, it deserves attention. The second sign is fatigue that does not match what you did. Not the normal, tired feeling after yard work or a long day with the grandchildren. This is the kind of tired where you sleep but still feel drained. You walk through the grocery store and feel like you need to sit down. You lose the energy to cook, move, visit friends, or take care of the house. Fatigue is one of the most common symptoms mentioned with fatty liver, and it is also one of the easiest to dismiss. The third sign is a general feeling that something is off. Doctors may call this malaise. You may call it feeling blah, heavy, sluggish, or not like yourself. Again, this is vague. That is the problem. Fatty liver rarely announces itself clearly in the beginning. It whispers. The fourth sign is brain fog, but this one needs careful wording. Brain fog is not considered a classic early symptom of simple fatty liver. But if liver disease becomes advanced, toxins can affect the brain and cause confusion, slowed thinking, personality changes, or a flipped sleep schedule where someone is awake at night and drowsy during the day. That kind of mental change is not something to brush off as normal aging. It needs medical attention. The fifth sign is skin change, especially itching, yellowing of the eyes or skin, or spider-like blood vessels just under the skin. These are not typical early fatty liver signs. They are more concerning because they can show up when liver disease has progressed. If you notice yellow eyes, worsening itch with yellowing, or new spider veins along with other symptoms, do not just cover it up or wait months to mention it. The sixth sign is elevated triglycerides. You do not feel triglycerides, but they are one of the most important clues on your lab report. Fatty liver is tightly linked with high triglycerides, low HDL, blood sugar problems, high blood pressure, and belly fat. If your doctor says your triglycerides are high again, that is not just a heart issue. It can also be a liver clue. The seventh sign is dark urine, especially if it comes with yellow eyes, pale stools, itching, or feeling very unwell. Dark urine can happen from dehydration or medications, so it is not automatically liver disease. But when it points to bilirubin buildup or jaundice, it can signal something more serious than mild fatty liver. That is a get checked sign. Here is the part that should give you some control back. For most people with early fatty liver, the foundation is not a complicated drug routine. There is now an approved medication for certain adults with more advanced MASH and fibrosis. But for the broad group of people with fatty liver, food, weight loss when needed, and metabolic health are still the center of treatment. And the strongest food pattern is not extreme. It is a Mediterranean-style way of eating. That means vegetables, beans, lentils, chickpeas, fish, olive oil, nuts, whole fruit, and fewer processed foods, sugary drinks, and refined starches. The biggest target, if you are carrying extra weight, is steady weight loss. Research shows that losing 7 to 10% of total body weight can improve liver fat, inflammation, and fibrosis markers. For some people with MASH, losing 10% or more is linked with better odds of fibrosis improvement. That does not mean starving yourself. It means lowering the flow of fat and sugar into the liver so the liver can start unloading what it has stored. Start with drinks. If you drink soda, sweet tea, fruit punch, sports drinks, energy drinks, or a big glass of juice every morning, that is one of the clearest places to begin. Liquid sugar is easy to overconsume, and excess sugar can push the liver to make more fat. Replace it with water, sparkling water, unsweetened tea, or plain coffee. For many adults who tolerate it, plain coffee may be liver-friendly, especially compared with sugary coffee drinks. Some reviews suggest the benefits are clearer around 2 to 3 cups a day, but think of that as an option, not a prescription. If coffee raises your heart rate, worsens reflux, or affects sleep, do not force it. Next, change the fat you use most often. Use extra virgin olive oil as your main added fat, instead of butter or shortening. A practical amount is 1 to 2 tablespoons a day, worked into meals. Drizzle it over vegetables. Use it in salad dressing, or add it to beans. The monounsaturated fats in olive oil support insulin sensitivity and fit the Mediterranean pattern linked with better liver and metabolic outcomes. Then add a small handful of nuts most days. Walnuts, almonds, pistachios, or mixed nuts can replace chips, cookies, or crackers. About 1 ounce, or 28 grams, is a reasonable serving. Nuts bring healthy fats, fiber, and minerals, and they help reduce the snack cravings that often lead back to refined carbs. Build meals around non-starchy vegetables. Broccoli, Brussels sprouts, cauliflower, spinach, kale, arugula, zucchini, asparagus, and mushrooms give you fiber and volume without a large sugar load. They help with fullness, blood sugar control, and weight loss, which are central for improving fatty liver. Bring in legumes several times a week. Lentils, chickpeas, black beans, and other beans are slow-digesting, fiber-rich carbohydrates. They are especially useful when they replace white bread, white rice, pasta, or processed meat. A bowl of lentil soup, black beans with vegetables, or chickpeas over a salad is simple liver-supporting food. For protein, aim for fatty fish twice a week if you eat fish. Salmon, sardines, trout, and mackerel provide omega-3 fats that can help lower triglycerides. The evidence is stronger for triglyceride improvement than for guaranteeing liver reversal. But because triglycerides are so closely tied to fatty liver, this is a smart swap. If you struggle to get enough omega-3 rich fish consistently, there is a simple supplement option linked in the description below. Think of it only as support for the Food First plan, not a replacement for fish, vegetables, weight loss, or cutting sugary drinks. Choose whole fruit instead of juice. Apples, oranges, pears, and berries come with fiber. Juice is much easier to overdo and acts more like a sugar load. This one change alone can make breakfast far better for the liver. Also reduce the foods that push the liver in the wrong direction. Donuts, pastries, sweet cereals, cookies, crackers, white bread with jam, and ice cream combine refined starch and sugar in a way that raises glucose and insulin quickly. Frequent processed meats and too much red meat also do not fit the Mediterranean pattern. And even though this condition used to be called non-alcoholic fatty liver disease, alcohol can still damage the liver, so it is wise to avoid or limit it if fatty liver is a concern. The goal is not perfection. The goal is to stop feeding the cycle. Less liquid sugar, fewer refined carbs, more plants, more fiber, better fats, enough protein, steady weight loss if needed. If you have yellow eyes or skin, dark urine with pale stools, a swollen belly, leg swelling, confusion, vomiting blood, black stools, fainting, or major personality changes, do not treat that with diet alone. Get medical care. But if your warning signs are fatigue, right side discomfort, high triglycerides, belly weight, and blood sugar creeping up, you have room to act now. This week, make one liver first meal every day. Vegetables, beans or fish, olive oil, and water instead of a sugary drink. Your liver is not asking for a miracle. It is asking for fewer burdens, repeated daily, long enough to heal.